Hello and welcome. This webinar, Could Your Practice Pass an OSHA Inspection, of course, is brought to you by Viva Learning. And my name is Mary Gavoni. I'll be your presenter for this evening. And just a couple of housekeeping things I want to mention as we get started. We do have time reserved at the end for questions and answers. If you have a question, please submit it in the Q&A section on the toolbar that's either at the top or the bottom of your screen. Avoid using the chat box because it's difficult to monitor two places. So all the questions in one place, please. And I've listed a lot of resources throughout the program, and at the end, I will tell you how you can access those resources. There should be a handout that you can access with course materials, so you can have a copy of that for later reference. And if I can get my screen to change. So we want to thank Ansel, our sponsor for this evening. You may be familiar with them for their amazing Microflex gloves, but you may not know, and because ergonomics is one of my specialty areas in dentistry, that they have some great ergonomic devices that you might want to take a look at, especially those of you who stand, maybe in oral surgery. When you're working, anti-fatigue mats are very, very important to prevent back injuries, leg injuries, and hip injuries. So those are great devices. And also step stools, which are great for not only assistance, because you need to be sitting higher than your doctor's eye level, so your feet shouldn't be able to touch the floor. And also, if you are standing, a step stool is good to keep by your side so that you can periodically raise one foot up onto the stool to help relieve pressure on one side of your back. So thank you again, Ansel, for being our sponsor for this evening. So these are our objectives for this evening. We're going to talk about some tools for assessing your level of OSHA compliance, how to implement some organization systems to maintain documentation, sort of make you bulletproof if you did have an inspection. We are going to identify the required safety plans that OSHA wants you to have, and they've added a couple if you haven't done any updates recently. And then we're going to look at OSHA's COVID-19 requirements, which is where the new safety plans come in. So before we sort of dive in, I want to just for those of you who may not have worked in dentistry for a long time, just kind of give you a quick history of OSHA. They actually came into existence in 1970 as the Occupational Safety and Health Act. And we didn't know until the hazard communication standard came out in the, late 1980s that OSHA really took a look at what we did in dentistry, or they never really paid too much attention to us. They mostly focused on industrial setting, manufacturing, construction, and those types of things. But the most important part of this OSH Act, or the basic premise of OSHA, is the general duty clause, which says that employers must provide a workplace free from recognized hazards that are likely to cause death. Fortunately, we don't have those in dentistry, or serious physical harm. And there are requirements for employers and requirements for employees. So employers are required to provide things like PPE and training, and employees are required to participate in training and to wear their PPE. Most of the OSHA standards are not focused strictly on dentistry. Until actually the COVID pandemic, we didn't have any specific rules for dentistry, but we do now. There is a separate page. I've given you the link on the slide here to the OSHA page that talks all about dentistry. And this is a timeline of the standards as they came about in dentistry. So again, 1970 was general safety, 1986 was hazard communication. And for those of you that were working in dentistry back then, as I was, You know that this just caused all kinds of havoc with OSHA inspections, because OSHA was actually doing random inspections in dental practices back then. And nobody within OSHA, the inspectors and so forth, really understood dentistry. So they had some kind of unrealistic expectations. Then in 1991, of course, our infection control rules, the bloodborne pathogen standard came about, and again, caused a little havoc in dentistry for a while. But I think over the years that the OSHA inspectors, at least the ones I have worked with, have now gotten a better understanding of what we do in dentistry. 2001, we had an update to the bloodborne pathogens about sharp safety. And in 2018, OSHA updated their respiratory protection standard, which now applies to us in dentistry from the requirements of wearing respirators, the N95 respirators. And then last year, OSHA came out with interim guidance. And some states, which we'll talk about, have specific COVID-19 rules that apply to all healthcare settings. So these two documents here are the interim guidance that OSHA put out or put forth that are specific to dentistry. The document on the left-hand side of the slide, you have the link there to the document. That is the one that gives us our information about wearing respirators, the levels of risk, and differentiates between non-aerosol generating and aerosol generating procedures. Then the document on the right is kind of a checklist of requirements for dentistry. Now, these two documents about preparing to go back to work after most businesses were closed down in the beginning of the pandemic are not specific to dentistry, but you still should have them on hand in your practice so that you can go and reference them if you need to. And here's my first tip of the program, and that is don't spend time and money and paper and ink on printing off these standards. Download them, save them in electronic format. They're in PDF format, so they're easy to bring up and read. We need to go electronic, I believe, with all of our documentation for OSHA. So I see there already are at least is one question about inspection. So my first question that I'm sure that many of you have is, how do you get selected? How are you chosen to be the special recipient of an OSHA inspection? And there's essentially three ways. One is a complaint. So it could be a current employee. It could be a former employee. Disgruntled former employee complaints are relatively common for OSHA to receive. But what you need to know is they view those differently, in a different light, if you will, than they do complaints from current employees, because they understand that sometimes this is a form of retaliation. And it's not their first rodeo in dealing with these complaints. Complaints are always anonymous. Although in a dental practice, if somebody made a complaint, it wouldn't be too difficult to figure out perhaps who made it. But remember that the Whistleblowers Act protects anyone who does make a safety complaint against an employer. Now, OSHA inspections can also be instigated by a referral from another regulatory agency. For example, a board of dentistry. If a complaint is made to the Board of Dentistry that deals with employee safety, then that complaint is typically referred to OSHA, because the Board of Dentistry's jurisdiction is really patient safety. So if it's a patient safety issue, the Board of Dentistry deals with it, or it might be a peer review committee at a dental association or something. But if it is an employee safety complaint, it gets referred over to OSHA to follow up on. Now, what we also see are what are called emphasis programs, national, state, and local emphasis programs. So OSHA sees a particular safety violation or a particular issue. Right now, their issue is protection from COVID-19 transmission. And so they're doing unannounced inspections in some states. The ones that I know of for sure that have an ongoing program are Tennessee and Michigan. And they will come by the office to make sure that you're following all of the rules. So if you do have an inspection, I will talk about that. I'll address that in a minute. But just Monday, we had in the OSHA Quick Takes newsletter an announcement that the enforcement of the COVID-19 rules and respiratory protection standard is a special emphasis on a federal level, which of course then spills down into the states. And the Biden administration, love them or not love them, has said that worker safety and COVID are one of their key initiatives. So this is a link to that particular document, and you need to know what that contains. But I'm giving you the cliff notes here. First and foremost, they want you to conduct a hazard assessment. I'll show you a form for doing that. Identify control measures to limit the spread of the virus. And that has to do primarily with respiratory protection, air filtration, and so forth, screening patients, screening employees. You need to adopt policies for absences from work that do not punish workers. If they get sick, they get sick. Now, the complication here, and we're not going to address that this evening, that's a whole other webinar, is what do you do for these people if they do get sick and they have to be quarantined for up to 14 days? Do you pay them? Do you not pay them? There were requirements up until the end of 2020 under the CARES Act, but the CARES Act is kind of in limbo right now. So I will not address any questions about that if employees need to be paid. I have some opinions, but I'll keep those to myself. You must encourage employees who are sick to stay home. And it's not so much the threat of transmitting COVID, if that's what the employee is sick with, to patients, because typically when you're in the treatment room, you're wearing all your PPE. It's the other areas of the office, particularly the break room, where people are there, maybe not social distanced, and they don't have face masks on because they're eating, and somebody's COVID positive and shares it with the rest of the team. Same thing with morning meetings. So need to make sure. You also need to have a policy, a preparedness program for COVID-19, preparedness and response plan. And you need to make sure that if someone raises a concern about their protection, that there is no retaliation against them for raising a question. Now, I show you this website here as, I guess, proof or verification that OSHA inspections are happening. Someone made a comment to me on a conference call a few days ago that, oh, you're just raising lots of issues and you're being too dramatic about OSHA inspections. They're not really happening, but they are. So if you wanted to see for yourself, at the very top of this slide is the web link for what's called an establishment search. And so all you have to do is type in dental, and you can pick a particular state if you want, and then just do your search. You can pick a time period, do your search, and this is the search that I did, and these are the results I got. This is from March of 2020 through the beginning of this month. 35 inspections. Now, there's more information that you see when you pull this up, but I'm not into shaming anybody, so I left all the practice names off. But these are just complaints that have happened in dentistry, and you see that many of them have come in since we've been back to work during the pandemic. We saw very few in the time in March when we were closed down, and then they seemed to escalate over the summer and the fall. Now, you may have heard there was one very highly publicized case that happened in Massachusetts, where initially the fines were reported to be $24,000 for all the violations that were found. And they were negotiated down, which is part of what you can do with OSHA to $9,500. So that's a considerable difference, but it's also a pretty big chunk of change that you have to pay to settle those issues. And the issues that the citations were focused on were lack of respirators, lack of respiratory protection plan, and lack of training about respiratory protection, among other things. So they're happening. You need to be prepared. And what I want to do is give you all some tools that you can utilize or implement in your practices. So we have a question already that says, if OSHA comes for an inspection, can you request them to come back at a different time? And the answer to that is yes. But it's going to depend on the inspector. It's going to depend on how serious the complaint is and how well, I guess, they are treated when they come in. So you have the right, and my approach and how I coach my clients all the time is to say, you know what, we are treating patients right now. So not only do we have to protect the privacy of those patients, but there also is the potential for exposure from aerosol. So you might want to come back at a time when we are not seeing patients. Now, you can't ask them to come back in 6 months. That won't happen. They may want to come back later in the day. They may want to come back that same week. What I find is in areas where the population is smaller, the inspectors are more likely to reschedule. They are less likely to reschedule in an area, a major metropolitan area, because it's a hassle to get there, fight the traffic, and so forth. But you do have rights. I've shown you and given you a link to a booklet here that talks about what your rights and responsibilities are as an employer if you have an inspection. And one of the most important things to remember is that if you do have an inspection and they do cite you, you always have the right to dispute them and to defend any citations, but you have to have some documentation, research, not just an article that's not based necessarily on science, more opinion than anything else, or you can prove that it's not a hazard that they believe it is, because sometimes it's a misunderstanding. I worked with a practice that was going through an inspection a number of years ago, and the inspector came from the HVAC industry and was obsessed with the fact that the practice used nitrous on patients rather frequently. And what the inspector cited them for was not stopping before each time they used the nitrous and having a safety briefing. And I said to the inspector, I said, you've got to be kidding me. They are already trained. They know what to do. They don't have time in their schedule to stop and call everybody on the team together and have a little powwow in the hallway and go over the safety briefings. They've been trained. They understand it. So we were able to make that go away. But what he also said was that the business team members needed to wear respiratory protection because they were exposed to the nitrous. Like, okay, no, that's not happening. We have a scavenging system. We're making sure that patients are not talking when they have the nitrous nose piece on and they're breathing in and out through their nose, not their mouth. So no, there's not a serious threat to those people working in the business office. Plus, a face mask isn't going to stop it. So again, you can make those kinds of citations go away. Not always, okay? So if the inspector comes, and I would encourage everybody to, first of all, be very respectful. Just let them know you're seeing patients. Can we do this at a more convenient time? And they will want, first of all, to see a list of items. They'll come in with a list of things they want to see. And it's typically training records, copies of your safety plans, OSHA posters, and some other things that are typically specific to what the complaint is or the referral was. They will interview the person who's the OSHA manager. So make sure that you have someone designated in your practice as the OSHA manager. It can be the doctor, it could be any member of the team, but they have to have some knowledge and they have to be able to manage the program. They also typically interview employees, and some of the typical things they do when they interview employees are have to do with asking them to demonstrate their use of PPE, or they will pick a product out of a cupboard or a drawer and say, where is the safety data sheet for this? And they do a walk around, they look to see if there's any violations. And there could be two types of inspections that might happen. One is a full-on inspection where they go through everything. They go through the whole office. They look at violations or potential violations of the general duty clause, of bloodborne pathogens, of the hazard communication standard, and so forth. The other is a focused inspection. And that is they just look at what is the basis of a complaint. So once they've done that and done their walk around, they will most likely give you an initial inspection report that just lists the potential violations that they've looked at. Then they'll schedule a follow-up visit with the entire inspection report, and that would include any violations. So at that point is when you have the opportunity to ask for clarification, to defend yourself against the citations and so forth. And that leads to what's called an abatement conference. And that's typically a closing conference where if they cited you, for example, that you didn't have written safety plans, you would have the opportunity to show that you've completed that you've brought your training records up to date and so forth. Whatever it is they're asking for, you need to prove that you have done it. And they typically give you about 30 days to do that. If they feel it's a really serious violation, then they may give you less time than that, but they typically give about 30 days. And then once that is finished, then your practice name, unfortunately, goes into that pool on the establishment search, and so someone can look up if they want to. So first and foremost, what do you do if the inspector comes? Number one, make sure they have a face covering on, because remember, everybody is supposed to have a face covering when they come into your facility. Verify their credentials. There are bad actors out there who are masquerading as OSHA inspectors, and they will come in with a pretty authentic looking business card, but you can go and download the OSHA logo and so forth from the internet, and in your home office, and with a printer, you can make yourself a business card. And what these people do is either case your office. So if they think maybe there could be drugs that they could obtain and maybe come back later after hours to try to get them, or they want to get money out of you. So in other words, if you let them in, they do a walk around and they give you supposedly a report from their inspection, and they'll tell you, okay, these are the violations. If you pay them today, it's this amount. If you don't pay them today, they'll double or quadruple or whatever. And they want to collect money from you on the spot. That is fraud. That is not how this system works. So I would want to see not just a business card, but an identification badge from their employer, either federal OSHA or a state OSHA division. If you're still not sure, I would call and verify that this person is who they say they are. Be very careful. We see this happening with HIPAA as well, and just people trying to extort money. So if you are not having currently patients waiting in your reception area, then I would ask the same thing of an OSHA inspector. Please wait in the lobby or wait in your vehicle, and we'll let you know when we're ready to see you. It's only if someone has been seriously injured or killed that OSHA can force their way into the office. And we don't see that happening typically in dentistry. Although we have had in the last couple of years several instances where dental team members have been killed by an estranged spouse at work. So that is a whole other story and an OSHA violation. So once you've verified they have a mask on, you verify their credentials, then ask them to wait outside the office if they will, and then notify the doctor, let the OSHA coordinator know, and once they come out, ask them to reschedule if it's possible, but be respectful. This is not when you get sarcastic or snarky. Treat them with respect. Thank you for coming today, even though your inside voice is saying, go away. Thanks for coming. Here's what I know. We're in the middle of seeing patients. We're trying to protect privacy. We're trying to protect safety with minimum number of people in the office. Can we have you come back at another time? So is it possible to pass an inspection? It is, but not without preparation. So the whole point of being ready is to make sure that you go through some verification of all the things that OSHA, excuse me, wants you to have in place. Excuse me. So this and the next slide will list out for you the types of things, the documentation that you need for passing an OSHA inspection. You need to have written safety plans for exposure control, and that has to do with bloodborne pathogens. And now for COVID-19, a preparedness and response plan for COVID-19. You need a hazard communication plan for chemical safety, and you need a hazardous waste management plan that puts you in compliance not only with hazardous waste while it's in the office, but how you dispose of those things. Then you need what is called an emergency response plan. And many of you probably have an evacuation plan with maybe a diagram of your office and so forth, how you would get out if there was a fire. But OSHA has elevated that requirement over the last couple of years with the number of violent incidents that have happened at work, like a disgruntled former employee coming back to a place of employment and killing the boss and killing coworkers. So that you need to have in writing what you do. Do you shelter in place? Do you evacuate your office? Where are you going to go? And again, that COVID preparedness and response plan and its companion, a respiratory protection plan. So the respiratory protection plan did not apply to us in dentistry up until the COVID pandemic, because OSHA has said that when we are doing aerosol generating procedures, we must wear N95 respirators or higher. We need to have a written respiratory protection plan. Those respirators need to be fit tested before we wear them. In spite of what you may have heard from other groups that fit testing has been suspended, it has only been suspended for the annual requirement for refit testing for employees who wear respirators all the time. And if you're wearing respirators, you need to have had a medical evaluation to document that you are physically able to wear a respirator. So those are, again, the written safety plan requirements that you need. So here's some examples of, I know somebody's asked a question about, excuse me, about how do you know what are all the things. So I've developed some checklists that I go through with my clients that I work with. And we just go through to see what they have, what they don't have, what they need to do it. And then of course, when we have completed those items. So here's one of 3 pages for infection prevention. This is one of 2 pages for hazard communication. And this is one for hazardous waste. And then here's one for respiratory protection. So these are a good starting point. Now, I know that some of you may have purchased an OSHA manual. If you have from one of your dental suppliers, you probably got compliance checklists in there as well. But you need to make sure that you go through and have all the things that you need. Just buying an OSHA manual does not make you compliant, because the ones that you would purchase from the ADA or from a dental supplier have a lot of information that has to be customized for your practice. So if you just simply used the templates that came with a purchased OSHA manual, then whatever you said or whatever it was that was your infection control or your exposure control plan in your manual would be what the OSHA inspector would be expecting you to do, and it may not reflect what you do, how you do things. So you need to be careful about that. So here's some things we've learned from the COVID-19 era inspections. What are OSHA's expectations? Now, first and foremost, there are 4 states as of today that have special COVID-19 rules: California, Michigan, Oregon, and Virginia. So I gave you the links on this slide to the rules, so you can screenshot this, or it's on your handout. The handout, when you download it from the Zoom webinar platform, is in a PDF format. And so all those links, when you open up that file, will actually be active. So if you click on it, it will open up those files for you. So what we've seen from these OSHA inspections is that not only does OSHA expect you to have an OSHA manager, they want someone to have been appointed as a COVID-19 coordinator, the point person, if you will. I've mentioned several times that you need a written preparedness and response plan. You need to have specific training, and many of you have probably done that during the course of the pandemic, especially when we were closed down for that period of time. You need to have training on the SARS-CoV-2 virus that causes COVID-19, and you need to be, which no doubt you are, screening your patients when they come in for treatment and screening employees for symptoms of COVID every day when they come to work. And that has to be documented. So when you're taking your patient's temperatures, make sure that you document it in your patient record, so that if OSHA says, are you screening patients to help avoid seeing patients with symptoms, you can say, yes, here's an example of how we record this in a patient chart. OSHA wants to make sure that you are reducing your risk of exposure to COVID-19, but also to other infectious diseases as well. So you have work practice and engineering controls. Engineering controls have to do with wearing respirators, aerosol containment, meaning increased use of high volume evacuation, especially for hygiene appointments, and air purification, whether you have a whole office air purification system or you have HEPA filtration units in each treatment room. That is one of the key issues that OSHA is looking for COVID-19 control. And here's what everybody wants to know. And I know someone asked if I can repost the link. It's in your handout where OSHA says you need to wear N95 respirators. Now, here's the deal. And I think there's been a lot of misunderstanding about wearing respirators. OSHA came out with this guidance back in May, and the CDC interim guidance, which OSHA uses for enforcement, has continually said wearing N95s or higher for aerosol generating procedures. But in May, earlier in the pandemic, we weren't able to obtain them. Even hospitals couldn't get N95 respirators. And so that's when the Food and Drug Administration released their emergency use authorizations for us to use other types of respiratory protection. But if N95s are available, and they are right now with dental distributors, that's what you need to be wearing. And it's especially important now that we have these new, much more infectious strains of COVID-19. Some of the strains, the UK one in particular, is said to be up to 80% more infectious. Even if you've had your vaccine, it still takes up to 2 weeks after you got your second injection to be fully protected. But what those vaccines are doing is protecting you from getting really serious symptoms of COVID. They're not going to be 100% protective of you getting COVID, especially a new variant strain. And so you can be sick and maybe be asymptomatic, but you're infectious to other people, patients, or your coworkers. So there's a lot of resistance about wearing N95 respirators. It's the cost, it's the fit, I can't breathe, and so forth. But my suggestion to you is don't look for these molded N95 respirators. They're very uncomfortable. You see the healthcare workers with the bruises on their faces from wearing those. Look at the duckbill style N95 respirators. The biggest difference here is that they seal around your face so that you're not breathing in any air or potentially aerosol particles around the sides of a face mask that may expose you to aerosol that contains COVID-19 particles. So, excuse me, look for the duckbills. And this is just an example of what a fit test kit looks like. Now, you do not need to outsource your fit testing. You can do it in-house. And I have some resources I can share with you about how you can do that. So KN95s, again, allowed only under the emergency use authorizations. Most of them do not pass fit testing. They don't provide a good enough seal. ASTM level is appropriate for non-aerosol generating procedures, unless you just can't get anything else. But again, these will gap on the sides, so it puts you at some level of risk. And the only reason that the CDC recommended them was because that is all that some people could get at the time. So at a time when the CDC is saying that the general public should be wearing 2 face masks because of these new variant strains, we ought to be upping our respiratory protection game, not double masking in dentistry, wearing the respirators, and also full face shields. Now, if you see the red circle on this picture of the full face shield, I specifically showed this picture to remind you that these N95 respirators with exhaust valves on them are not acceptable in a dental setting, because if you were infectious with COVID, you could exhaust it out that valve. So those are not appropriate. So SARS-CoV-2 and COVID-19 training for teams has to be updated regularly because new information keeps coming available, and that is true. I would expect that we're going to get an updated set of guidelines for dentistry from the CDC in several weeks. I don't have any specific date, but because there's been changes with these variant strains of the virus, we're probably going to get an update. So we talk about our infection control practices, how we use PPE, what do you need to do if you have COVID symptoms or somebody is diagnosed or test positive for COVID. And OSHA also requires that you tell employees how to report unsafe working conditions. This is an interesting little twist, and not something that you every employer certainly wants to do, is say, oh, call OSHA if you think this is unsafe. So I'm going to say this because I see still a lot of social media posts. from dental team members who will complain on social media for the world to see how terrible they think their employer is, how unsafe they think their dental office is. And I gotta say, I think that is absolutely inappropriate. If you have questions about safety in your practice, sit down and have a rational discussion with the team, with your doctor, and be honest about how you feel. And doctors, employers need to be willing to listen to those rather than people going out on social media and ranting, because people see that and it could potentially be a reflection on a dental practice. And that is never a good thing. So let's keep it in-house. Let's work it out together if we don't feel safe. So I mentioned the OSHA or the COVID-19 coordinator earlier. It can be the same person as the OSHA coordinator. It doesn't matter, just that somebody is designated in your preparedness and response plan as the person who's in charge. And so you document any exposures, you keep records of the employee screenings and so forth. So it can be the doctor, could be an assistant, a hygienist, the office manager. It's whoever you feel is most appropriate on your team. So here is an example of just the opening page of a COVID-19 preparedness and response plan. In many states, they have drafts of these. Some of the state dental associations have them. I have a template that I've developed for use with the practices that I work with. And then in addition to that, you need to have two other types of documentation. One is a hazard assessment, one's an exposure determination. So the hazard assessment is actually a listing of what are the hazards they're exposed to and how do you mitigate those hazards, meaning with PPE or other engineering controls. And you also need a hazard assessment for the bloodborne pathogens and the hazard communication standard. So this is a copy of the hazard assessment that I have developed for the practices that I work with. It is actually a PDF fillable file, so you can pull it up on the computer and just do a bunch of check boxes on here. And I recommend that it's done on a weekly basis. And the reason is that the number of cases in your area, which is part of the hazard assessment, may be increasing or decreasing. They're going to change. And your supply of PPE that may be available will also change, perhaps on a weekly basis. You all know the challenges of trying to get PPE at this point. So that's one example. Then an exposure determination actually designates which employees are exposed to the hazards that you identify. And you also need to have this documented for the bloodborne pathogens standard. So this is an example, again, a template that I have developed that can be edited. And here we list these are the risk categories that OSHA has designated for us. And anything that is an aerosol generating procedure is considered by OSHA at this point in time to be a high or a very high risk procedure. So that needs to be documented. Now, I know that especially in the inspection case in Massachusetts, the practice was not wearing N95 respirators, and they told the inspector they did not have them. They couldn't get them. And so what the inspector wanted to know, and I've seen this in several other inspections as well, show me that you attempted to get them. So they're not just going to take your word for not being able to get the N95 respirators. So what you need to document is any attempts that you've made to order or purchase them. That is your saving grace from that kind of a violation. And again, you need a written respiratory protection plan if you are wearing those KN95s or N95s. So again, some other things that OSHA's looked for in these COVID-19 era inspections: logs, as I mentioned before, for employee screening, recording in your patient record of the patient screening, documenting any potential exposures. It's almost like an exposure incident report that you would do for a needle stick or a cut with a contaminated instrument. And then you document any quarantine or self-isolation that's been recommended by your local health department for any employees. Now, some of these records are confidential medical records. So if I have to document that an employee had to be quarantined because they have COVID, then I'm not going to store that record in my OSHA manual files. I'm going to store that in a secure file or in a locked file cabinet if it's a paper record that not everyone has access to because it's confidential information. OSHA can have access to it, but everybody else should not. So if you are exposed to COVID-19, part of that preparedness plan is making sure that you are wearing the right PPE and so forth. Now, this is a great photo, and you see my caption, "Where's the PPE?" This is obviously done pre-COVID, but if we were in this educational setting now, there wouldn't be this many people. They're too close together. They would have this not an aerosol generating procedure, so they could have a face mask, but they would have a face shield on as well to protect themselves. So if you had an exposure, say a patient called you after they were in and said, "Oh, I just found out I have COVID-19, or I knew I was COVID-19 positive, but I really wanted my teeth cleaned." You'll be amazed at how often that happens. Then you need to call your local health department. And if you were wearing all the appropriate PPE, then most likely the health department is not going to require you to be tested, quarantine, self-isolate, unless they tell you, but typically not, but to monitor for any symptoms because they believe that that's a low risk exposure. But if you're not wearing face coverings at all times in the office, except when you're eating in the break room, then your risk is increased. And I would say at least once or twice a week, and it happened to this weekend to me, got a call from a practice that has 2 employees who have tested positive for COVID. They were at work for 3 days when they were probably already infectious. So the health department said, "You all need to be tested. You all need to self-isolate until you get your test results back." And so then they had to close the office because it was the entire team sitting in the break room, eating lunch together, all close to each other, less than 6 feet apart, with no respiratory protection. So that is one way you can significantly lower your risk of exposure. The exposures are not happening to the team members from infectious patients. The exposures are happening from one team member to the other, not socially distancing and not wearing face coverings. So be careful. So if you're wearing a face mask out in the community, you have a lower risk and social distancing is observed. If you have an exposure to somebody in your household, you have a higher risk. You're probably going to be, if your spouse or a child or someone you live with, a roommate, test positive for COVID, the health department would probably say you need to self-isolate and then test. And if your test is negative after 7 days, then you can stop the isolation. But the bottom line is you always follow the recommendations of your local health department. So if you have an employee or somebody who's been in your office that has COVID-19 and they were COVID-19 positive when they were there, you call your health department, you notify all those people. But I want to clarify that you don't necessarily have to notify all of your patients unless the health department tells you to. Because if you were wearing your appropriate PPE while you were treating patients, very minimal risk that they were exposed. But if it was somebody who came in to the office who maybe was there for a period of time not wearing a face mask, then you'd need to let them know that there was a potential exposure to someone, especially if it was another employee. And if an employee is hospitalized for COVID-19 or they die from COVID-19, heaven forbid, that must be reported to OSHA. That is reportable to OSHA. It is also obviously reportable to your health department. So OSHA updated its guidance on quarantine. So you should have a copy of this particular document in your practice so that you know it's typically 7 days of self-isolation if you test, and if you test negative, then you're released from quarantine. But if you don't test, then you have to wait 10 days with no symptoms to be released from self-isolation or quarantine. So that's all explained in that document that you should have in your office. So here's my recommendations for you to be prepared for an inspection. Number one, get out the OSHA manual, dust it off. Hopefully you can find it. Make sure that you've documented everything. Make sure you've updated your safety plans. They need to be reviewed and updated on an annual basis. Go through compliance checklists, make sure you have training records, and make sure your inventory of your products, your chemicals in the office is up to date, and that your safety data sheets are up to date. Get it organized. Best way, as I said earlier, that I know how to do that is go electronic. OSHA will accept electronic documentation. They didn't a number of years ago, mostly because they didn't trust that we would have backups of that information. And once you have your safety plans documented on your computer in a Word file, then you can easily edit them whenever you need to, and you can track any changes that you make to those plans. So organization is key. So I want to again thank Ansel for their generous support of this program tonight. They bring this to you so that you may enjoy the complimentary continuing education. We are going to move into Q&A right now. If I don't get to all the questions, we've got about 10 more minutes to go. And if your question wasn't answered or you would like to discuss it further, then just email me, mary@marygavoni.com, and put Viva23 in the subject line so that I know where your question is coming from, because otherwise it's a little difficult to put it into context, because a lot of times people will send me a question and say, you said this, and like, ooh, I don't remember when I said that. So let's see. For new practices, how can you make your office OSHA compliant? And who can we contact for yearly OSHA courses? Well, I am available as a consultant, but there also are many of my colleagues who are available as consultants to help you with that. So if you would like some information, I'll be happy to get that to you. You can email me and I'll send you some information. Next question, what is the difference between recommendation for COVID and regulation? Does the doctor have to do recommendations? I don't know of specific laws that must be followed, only guidelines. How do you get your office to follow the guidelines? Oh, I'm so glad you asked this question, because everybody wants to know that. In terms of OSHA, there is no differentiation, especially with respect to COVID-19, between the CDC guidelines and the OSHA interim guidance and OSHA rules. OSHA clearly says in their interim guidance, you must follow guidelines from the CDC. And many of your state dental boards also say that you must follow. In the dental rules, they say you must follow CDC guidelines. So we get all hung up in dentistry about, well, it's recommended or it's required. It means the same thing. And especially now, OSHA's really cracking down on that, especially in that bulletin that they released on Monday about stronger enforcement. Georgia local and state was notified by phone of many violations, was told you should just try and find another job. Okay, so bottom line is this person quit their job because the conditions were unsafe, and that's probably a good decision. That if it really is that unsafe, don't stay. What about fit testing of KN95 masks? KN95s are respirators. They must be fit tested, but they probably won't pass. I think I mentioned that before because they're not made to the same standards as our N95 respirators. I think the next question we already answered. Are we required by OSHA to wear N95s? Yes, for aerosol generating procedures. Okay, the question about this is a question, is my understanding that now that N95 respirators are available from dental supply companies, the waiver for annual fit testing is no longer valid. That is not true. OSHA has still suspended the N95 annual fit testing, but they never suspended the requirement for initial fit testing of respirators. So what we should have done, those of us who have been wearing N95 respirators, is had them fit tested when we first started, but we didn't know that we needed to do it or didn't know it was being enforced. And we were told actually by some groups that it wasn't needed. It was voluntary or it was suspended. But keep in mind that because supplies are still a little iffy, that if you don't get the same brand of respirator every shipment, then you have to fit test every time you use a new type of respirator. So you still need to do initial fit testing, but until OSHA says we don't have to do annual, that is still suspended. Is it the employer's responsibility to pay for the training necessary for the COVID coordinator and OSHA officer? OSHA doesn't specifically address training for the OSHA officer, but if whoever is the OSHA officer of the COVID coordinator, they're an employee, so they fall under that rule of that training has to be provided for all the employees. How do you access slides from this lecture? You should have a link on your toolbar that has support materials or something that you can download the handout. How can I obtain this webinar for offline use? If you're talking about the recording, that will be explained to you. It will be available for on demand probably early next week. What happens if the employer doesn't want to get the N95 and thinks KN95 is enough? It has worked all this time. It will be fine going forward as well. KN95s are better than a level 3 mask because they at least seal a little better, and employers are running the risk of OSHA fines and inspections if they don't get N95s. But the big issue right now is absolutely the fact that there are these new variant strains that are just that much more infectious. So if they're easier to contract, even if you've had your vaccine, and you can breathe in aerosol particles through the sides of a ASTM level 3 mask, then you're putting yourself at risk. So there's two edges to the sword here. The first part is regulatory. You run the risk of of getting cited for an OSHA violation. And the other is you run the risk of getting sick. Do you still need to wear a respirator if wearing ASTM level and a face shield? Absolutely. I think we've talked about that quite a bit already. ASTM level 3 with a face shield, according to OSHA, according to CDC, is for non-aerosol generating procedures, not using a handpiece, not using an air water syringe, not using an ultrasonic scaler. I missed the beginning, and I'm hearing references to a handout with links to the website. That should be on the toolbar for your webinar. Will a different handout be forthcoming? No, not a different handout. If N95s are available, is a KN95 still permissible? Not according to OSHA, not according to CDC. There have been some arguments about what aerosol producing procedures are. Some offices I've heard of, RDHs aren't allowed to use cavitrons at all, so avoid so they avoid having to use an N95. Some offices do not let them use polishing handpieces. Well, there was a lot of misinformation about this, I think, in the beginning, because the CDC actually said that aerosol generating devices were not recommended, but they've since removed that requirement. But you absolutely need an N95 if you're going to use a Cavitron. And we know that ultrasonic scaling is more therapeutic for patients, but you've got to have the right respiratory protection. Are face shields required in addition to N95 respirators? Yes, that is eye protection and splatter protection. Okay, I think the next question from Jess is something that we've already covered about requirements versus recommendations. Do KN95 and N95 provide the same level of protection? Concern is over the fit. The concern is about the fit and the seal. That's the difference. And the KN95s are not made and tested by the National Institute for Occupational Safety and Health to our US standards. Good question. How long do we need to save the safety data sheets for products we no longer have in the office? You need to save them forever. So archive them. Don't get rid of them. Archive them, because you have to prove you had the safety information when you use the product in case something shows up in the future. Okay, the in-office fit test procedure is something that can be done by you. You don't need a special certification. You need to get training to do them. You need to buy a fit test kit. And I will, in the resources document that I talked about, that you can order on my website, I have all that information that you can access about how to get medical evaluations, information about how to do the fit testing. So that's all available in there. Thank you for your feedback on for corporate offices. How do you suggest compliance with OSHA regulations? They need to follow all the OSHA regulations according to the state that is in. For in a corporate office, if it's not an office where dental treatment is being done, they certainly need to be wearing face coverings. I had a mask. I passed a mask fit test. Do I need to refit the mask? Only if you start to wear a different respirator. So if you different brand, then you need to test again. Fit testing. Oh, that's a great question, Bethany. Thank you for asking that. What does it mean? It means that you actually put a hood over someone's head with a respirator on, and you introduce a mist of a bitter tasting solution into this hood. And if that bitter tasting solution can be smelled or tasted, then you don't have a seal on a respirator. So it's not the right respirator. So hopefully that's the quick and dirty explanation of that. Okay, I think we are now at time. So if I did not answer your question that you submitted, email it to me, mary@marygavoni.com, and put Viva 23 in the subject line, and I will be happy to answer that question for you. And now I'm going to turn this back over for instructions for your CE. Thank you again to Ansel. Thank you for your participation.